Okay, we're talking about eating disorders, and we talked about bulimia nervosa, where we actually gag ourselves and cause ourselves to throw up. Let me tell you some consequences of that again. The salivary gland is very enlarged. So bulimia nervosa, how do we tell when somebody might have that? Okay, now once again, just because we have a few symptoms, don't jump to any conclusions. And once again, you've taken a couple of classes in psychology. You're not a psychologist, all right? But this is interesting. The salivary gland, okay, is extremely enlarged. Okay, now, this salivary gland is right here underneath your throat. Okay, kind of right here, and so it's so enlarged that the bottom half of the person's face looks really fat and really chubby. Now, does that help or hurt the situation? That hurts it a lot. Okay, because they think they're fat. The teeth, their teeth the enamel begins to eat away because of the acid, the stomach acid. So the teeth really begin to look terrible. And then we have a major electrolyte imbalance. We don't have enough salts in there, so we begin to have a lot of major cramps, and then we begin to have heart trouble. So that's a big thing with bulimia nervosa. And then let me mention some more causes for eating disorders. Okay, these are listed from your book. Cultural and social emphasis on exaggeratedly slender individual. So the fact that we feel like we've got to be skinny. Then this one's kind of interesting, and some of you, whether you deal with this, whether you're a parent and you're trying to work with your kids on this or not, the family emphasis on perfection and control. You wouldn't be, the fact that fat is an imperfection and you have no control. So the family emphasis on perfection and control, there's a balance to that. There's a problem with that. I mean, you want to encourage confidence, and you want to do the best you can, that kind of thing. But perfection is never achieved. And then it says possible genetic tendencies to poor impulse control. So there could be some genetic environments. And then it says possible involvement of the hypothalamus. In other words, we could actually have a genetic disorder in the hypothalamus that causes us to feel like we need to eat less. The hypothalamus stimulates the hypothalamus in our brain stimulates our appetite. Okay, so if the hypothalamus is not working, saying that we're not hungry or we don't want food, or our brain doesn't associate something good with food, that's pretty much a problem. Okay, now anorexia nervosa. Once again, this is where we just don't eat. It's a relentless pursuit of thinness. All right. So it's severe caloric restriction, often with excessive exercise. So if we're anorexic, we're going to make sure that we don't eat very much, we get very few calories, and then we exercise a lot. A person that's anorexic knows how many calories they're eating, and they know how many calories they're burning. So they're like, okay, today I took in, and it's ridiculous. A normal person, for a girl, 2,000 calories. For a guy, 2,500 calories, depending on your height and that type, then your body build. And that may be, high or low for you, I don't know. But that being said, a female that ordinarily would get 1,500 to 2,000 calories might take in 200 calories for the day. And with that 200 calories, they might exercise to the point to where they exercise off 300 calories. Well, that's our weight gain is calories in and calories out. The amount of intake and the amount of output. So, once again, they continually lose this weight battle. Okay? So, a person who is bulimic, which is bulimia nervosa, the weight is within about 10%. It says weight usually within about 10% of normal. Okay? All right, and this is the weight usually at least is 15% below normal to be true anorexic. You're 15% below normal. Most of them are more like 50% below. So once again, anorexia nervosa. That's limiting the food intake and increasing the exercise, decreasing the calories that we eat and increasing the calories that we exercise off. So we have bulimia nervosa, we have anorexia nervosa. Now other eating disorders, we have binge eating disorder. Binge eating is binging without purging. It's just as marked physical and emotional stress. There's some trigger that causes us to go and just start eating. Now, we all might have some binge eating moments, okay? We might just be, some people it might be, we won't count Thanksgiving, that's just a given, okay? But some people it might be I'm depressed, or something's happened to me, or it might be whatever. And binge eating is where we go and we might eat several days worth of calories at one time, okay? Which has a really crazy effect on our body, okay? So listen to what it says about binge eating. Okay, it's marked by physical and emotional stress. Okay, so there's something that stresses us that causes us to go binge eat. Accompanied by more general psychopathology than obesity without binging. Okay, which means that it's not, when you binge eat, it's not about your weight. Okay, it's not about your weight. It's the need to fulfill. It's the need to fulfill something that's not there. So if you feel bad, you want to feel better, right? Okay. So you feel bad, or you feel stressed, or you feel anxiety, or you feel something, and then you just go and you just eat. Okay. Now, why is that an eating disorder? Well, it's an eating disorder if it occurs. Okay, if it's an eating disorder, if it occurs 30 consecutive days. Can you imagine if instead of, I don't know about you, I don't know, I don't know what you would consider yourself binge eating disorder, but you probably go, I just go wild every once in a while, I get a bag of potato chips and just eat the potato chips. That's not binge eating. You're like, oh, well, sometimes I just go and I just get hungry, or I just want to eat, 20 pounds of M&Ms. Well, that might be exaggeration, okay? But binge eating is on a regular basis. Instead of dealing with, some people, like, if you're a binge eater or something, and it may be stress that's causing it, you need to say to yourself, okay, what else can I do? But a lot of times, binge eating for most people occurs, maybe once, I don't know how often. But can you imagine, instead of saying it's been over a month, or it's been 2 months, or it's been weeks, or whatever, can you imagine it happens to you every day, and it's kind of like, okay, so now your question is, am I going to be a binge eater this hour, as opposed to this hour, as opposed to this hour? Wow, now we're talking about something entirely different, okay? Now, then we're going to do another one, okay, eating disorder, rumination disorder. Now this one's kind of interesting, it's kind of gross, okay? And it's often, those of you that think you might have this, it's often associated with mental retardation because it's a malfunction in the brain. It's a malfunction in the brain that's causing this to happen. But in rumination, it's just like a cow. The person eats the food. Now, don't be grossed out over this or anything, okay? But the person eats the food and then regurgitates it back up into the mouth and chews it again, and then swallows it, and then puts it back up in the mouth and swallows. And so that's rumination. So once again, a really, really bad deal there. It says regurgitating, rechewing, or reswallowing partly digested food, a disorder of infancy, childhood, or adolescence. So this doesn't happen in older people. Once again, it says that it occurs in infancy, childhood, or adolescence. So the person probably doesn't even realize that they're doing it or realizing it's bad. Probably caused by biological and psychological factors. And so if somebody has this, what it tells us is, it tells us that there's a problem it tells them that there's a problem in the brain psychiatrically that's telling us it's triggering this rumination. So once again, so an infant does this, you're like, okay, well, what's going on there? They're swallowing the food, and then they're regurgitating it back up and chewing it some more and swallowing it like a cow might do. So what do we do in that case? Now, that's not something that just happens. We look at the brain, we say, okay, the hypothalamus, we look at the different part of the brain, like what's triggering this, okay? Now, the last one I'm going to talk about is called PICA, P-I-C-A. Now, this one's really interesting, and it's really bizarre. It's fun to talk about, but let me tell you what it is, okay? And it's often associated with mental retardation. However, we have seen people with PICA lately on the news that we can watch on YouTube. I don't know if they have mental retardation, but they definitely have PICA. It's repeatedly eating non-nutritious substance. Majority of causes accompany severe intellectual disability, There's, of course, potential for poisoning. The biological cause may be a mineral deficiency. All right, now that's what they're saying with pica, is that there's probably some type of mineral deficiency there, something that's causing the body to actually crave these things. So you can go on YouTube and you can look up. There's a guy. There's a guy, and I don't have his name in front of me here, but you can call up the guy who ate an airplane. And you're like, what? Yeah, this guy would eat metal chain, and you can imagine, probably not the best thing for his teeth, but he could eat metal chains. He also ate, and there's other people too, that eat glass light bulbs, okay? They break the light bulbs up. They're on YouTube. When you look up pica, you can see a lot of these. There's one video on YouTube, and we may put some of these on your site there, but this guy would crush up the light bulbs and put them in his salad, so that he could eat that broken glass with his salad each day. So once again, pica, we're going to eat things that aren't nutritiously normal. So here's this guy that ate the airplane. He got to eating metal, and he would eat metal parts and all these things, and how he ate them, I don't know, and how his body even dealt with that, I don't know. But his deal was to take a little Cessna plane, and his deal was over a period of a year to just keep eating all the metal parts till he had eaten the entire airplane. So, you know, he wasn't just a plain old guy, he was a little bit not. Actually, as you can tell, pica is something that's really not real natural, not real normal. Once again, we have definitely a mental issue with rumination and pica, but when we talk about bulimia nervosa, anorexia, and binge eating, we have to say it's possibly could be a chemical problem, could be a physiological problem, but a lot of times it's a trigger. And once again, let me go over these causes that we see. We say it's a fairly new phenomenon, and we have a cultural and social emphasis on an exaggeratedly slender body, family emphasis on perfection and control, and possible genetic tendencies to very poor impulse, and then also potential problems with the hypothalamus, which controls your appetite and your eating. So that in itself is a look at all the eating disorders. And with this test, we're going to cover eating disorders, and then I'm going to talk about sleeping disorders on the next video.